I'm Jeremy Kenton. I'm an osteopath, and I'm often asked the question, what is the difference between a physiotherapist, an osteopath, and a chiropractor? There are more similarities between these three than there are differences, but there are basic differences in terms of the type of training. As an osteopath, chiropractor, or physio in the UK, our training is 4 to 5 years full-time academic medical training. Here in Spain, it's a very different position, and very often osteopaths have had a very short training, as have chiropractors. But you can be assured that a British-trained osteopath or chiropractor or physiotherapist has had a very in-depth, long-term 4 or 5 year full-time medical training. So what are the differences between the treatments? Well, in terms of chiropractic and osteopathy, they are very similar. There's a basic fundamental difference in terms of philosophy. I've watched chiropractors work and said that's osteopathy, and they've watched me work and sometimes said that's chiropractic. They are very similar professions. The physiotherapy approach, traditionally, is that physiotherapists in state healthcare system practice are basically technicians, in that they are trained to provide a form of treatment at the advice and prescription of a doctor or an orthopedic surgeon or a rheumatologist. So they're tending to do what they're told to do. Physiotherapists in private practice, however, have often done postgraduate training in manipulative techniques. Now, there's a lot more to osteopathy than just manipulation. It's a complete health care system, and we're trained as primary care practitioners. Now, what that means is that we never know what's going to walk through our door. And for example, you may have a patient who comes in with back pain, a female patient, where her problems have got nothing to do with her back whatsoever. She may have gynecological problems, which are mimicking or producing back pain, but arising from a gynecological problem, in which case obviously we're not going to be able to treat them, and we have to refer on to a gynecologist. But our training is such that we're trained to spot that. So diagnosis is very, very important. Unless you know what the cause of the problem is, you cannot help the patient. And helping the patient is more than physically treating the patient. You need to actually establish the cause of the problem and then choose the appropriate treatment. And sometimes that treatment may not be with me as a practitioner, but me referring that patient on, which is just as important as me actually treating the patient. Choosing the right course of treatment is a nightmare for the general public. Who do you choose? Do you go and see a chiropractor? Do you see a physiotherapist? Or do you choose to see an osteopath? Now, obviously, I'm biased because I'm an osteopath, but there are times when I will refer patients for physiotherapy. One of the things that physiotherapists are excellent at is rehabilitation. So following hip replacement surgery or knee replacement, or following certain types of accidents or a stroke, the physiotherapist should be the approach that you should be adopting, and they're the ones that you should go and see. However, for maintenance of an arthritic hip or an arthritic spine, an osteopath or a chiropractor would be a good choice for you. If you've been involved in a road traffic accident, whiplash injury or other injuries, then any of those three approaches, chiropractic, osteopath or physiotherapist, would be a benefit. But once again, I'm biased and I'm going to sort of tend to indicate that you should come and see an osteopath. But you have to be very careful as to who you actually choose to see. And as I said, here in Spain, the standards of training are very, very different. Osteopaths in Spain can have gone through either a week training or months training or years training. There are very few full-time osteopathic schools in Spain, and for osteopathy in Spain, it's a very new form of treatment. You'll find that osteopaths will charge a variety of fees depending upon their level of education and depending upon their standard of training. and also, it has to be said, whether or not they are fully qualified. You often find physiotherapists, kinestherapists, advertising the fact that they're an osteopath and a physiotherapist and a chiropractor and offering massage techniques. And usually you'll find that these kind of practitioners have very little training or are trained in primarily physiotherapy and are using the other forms of treatment in terms of the fact that they're using the name of that therapy. They may have gone for a weekend training in osteopathy and certain manipulative procedures, but that's not what osteopathy is about. Osteopathy is a form of complete healthcare. One minute we can be dealing with somebody with a headache, the next minute with an ankle problem or a knee problem or a neck or a back problem. And as I said earlier in this video, it's so important to establish what the cause of the patient's problem is. And primarily our training as UK trained osteopaths is in diagnosis. We spend hours and months training in terms of specific forms of therapy, but we also spend more time in terms of learning our anatomy, and that includes morbid dissection. In other words, as students, we cut up dead bodies. Our anatomical knowledge and our physiological knowledge, our knowledge of how the body works, is essential, because unless you know what the normal is like, you cannot recognize the abnormal. And diagnosis in that respect is so vitally important. So when it comes to treatment, how do you make that choice? Obviously, many people are going to be guided by cost. And if you want physiotherapy, here in Spain, it's available under the state healthcare system and you won't have to pay. So it means that you're going to have to pay out of your own pocket to see an osteopath or a chiropractor or a physiotherapist in private practice. Some health insurance will cover it, but on the whole, osteopathy and chiropractic are not covered by private health insurance here in Spain, which limits the availability for some patients. But for those who can afford it, look upon it as an investment in the same way that you'd service your car. People don't skimp on looking after their car, but it's frighteningly obvious that they often do in terms of their bodies. So please remember that your body is vitally important to you. Don't take chances, and don't take chances in your choice of practitioner.